Hello, my name is Dr. Samantha Brown, and I'm very excited to be with you today talking about ethics and the role of self-care. So before we dive into things, I just wanted to briefly introduce myself. So as I mentioned, my name is Samantha Brown. I'm an assistant professor of psychology at Coe College here in Cedar Rapids. My background and training is in counseling psychology. So I graduated from the University of Iowa in 2018. My particular area of skills and training were with mental health in college students. So I've done a lot of work with college students as a therapist through my training, and then now, of course, work with college students as their professor. So it's been really fun to see sort of both sides of the worlds with college students. In addition, I have a passion for self-care, which is in part why I'm choosing to weave that into this discussion series. So my understanding is that you have a wonderful series of speakers lined up to talk about ethics and the workplace and how things maybe go well and how maybe they don't go so well sometimes. Obviously, I'm going to be talking about this from the perspective of a psychologist. And so I recognize that this is only one perspective. And my hope is that as we go throughout this presentation, you'll be able to find points of intersection that make sense for you in your own lives and in your own work worlds. So what are we going to do today? Well, I just want to start out by giving some background information, especially in relation to the American Psychological Association's ethics code. So that really frames how I think about ethics in the workplace. So I'll talk about what it is, some of the key pieces of it, and then I'll also talk about what gets in the way of us making good decisions. So obviously there's probably a lot of things that get in the way of us making good decisions, but we're going to focus in on how does distress or stress or burnout impact the choices that we're making. Then we'll talk a bit about what the role of self-care is in ethical decision making, and how is that even related, and then what can we all do in relation to this. So to get us started, what is an ethics code? Well, an ethics code helps to provide guidance for right and wrong. I really like this analogy of thinking of an ethics code as a compass. So your compass is not your GPS, right? It's not going to tell you exactly where you need to go, but it's going to help you to figure out what direction to take. So the compass might guide you to where you need to go, even if it can't give you the specific directions. And I think very similarly, that's what an ethics code can provide for an individual. In the case of the APA ethics code, it's a common set of principles and standards, and this is something that's relevant to all persons. So meaning in whatever capacity of psychology you're practicing, whether that's clinical work or teaching or as a student, it's still relevant to you. And it's across all activities and contexts. So again, whether it's clinically working with a client or as a professor teaching students, as a researcher conducting research, whether that's in person, on the phone, or over Zoom, as we all are now, these ethical principles and standards continue to be important and relevant. So why do psychologists need an ethics code? Well, in short, we're a profession, and like most professions, we need an ethics code to help with this guidance of our behaviors. So a profession can really be defined as a systematic body of knowledge with some kind of specified educational process. And it's typically where then those individuals provide some kind of special skill or service. So obviously professions are quite expansive and broad. This is everything from our engineers to our doctors to our lawyers, to any sort of profession that has this kind of special training. Now, psychologists in particular are a human service field, and just like any other human service field, we're often working with people who are pretty vulnerable, which I think really then highlights the need for us to be very thoughtful and careful in our behaviors and the decisions that we make. An ethics code can help to regulate the practitioners, and it can help us to be accountable and transparent to the public. So again, when we're providing this special service, of any kind of profession that does this, we really want to make sure that we're transparent and clear with the people that we're serving about what we're doing, what we can do, and their expectations of us. Additionally, this also gives us an opportunity to make sure that our practitioners are doing what they're supposed to be doing, and if they're not, that we have a specific process to go through to either remediate or to make sure that the practitioners continue to do what they're supposed to do. So what is in the APA Ethics Code? All right, well, there's quite a bit in it, actually. So the APA Ethics Code starts out with our principles, which are really these aspirational statements of our values. When I think about values as being this guiding force in our life that helps us determine what behaviors we might engage in. So for example, I may have a value of spending time with my family. Family may be really important to me, and consequently it is really important to me. And so that really affects the choices I make. I might prioritize spending time with my family, making sure I reach out to them, things like that. So within the APA Ethics Code, we have 5 of these principles, and these are things like integrity, that we're going to be honest and truthful, things like beneficence and non-maleficence, so we're working to do the greatest good and to do the least amount of harm with the people we work with, as well as respecting the rights and dignities of all individuals. Beyond these aspirational statements, which by the way are kind of hard to enforce because they are based in these values, we have what are called the ethical standards. And the ethical standards are a little bit more enforceable and give us a little more direction of what our conduct should be. Now, there are 10 sections of these different standards, and within those 10 sections, there's a total of 89 standards. So here's where I need you to pay attention. We're going to go through all of these. There'll be a test at the end. Just kidding. Obviously, we don't have time for all of that. But suffice it to say that certainly when the APA Ethics Code was created, folks were thinking about a lot of different important pieces that needed to be considered and wanted to make sure that these were covered so that practitioners knew what they needed to do. I also like to mention that there are actually a lot of what we would call modifiers in the code. So you could think of this as sort of tentative or hedging language. So there's things like reasonably or appropriate or potentially that are used throughout the code. And the idea behind these are that we can't in one document possibly capture all of the potential things that could come up in practice. And so this really does allow for some professional judgment, ensures flexibility when needed, especially given that we know things change fast in the world and we need some of that flexibility. It also, though, because it's not prescriptive, can make it sometimes challenging to know what's the best decision to make. So how does this go wrong? So how does this play out for psychologists? Well, there's sort of 2 main categories that I would argue of these ethical considerations. And the first one is ethical violations, and the second one is ethical dilemmas. So ethical violations, as you might suspect, are a little more serious than the ethical dilemmas. And these are when there's been a clear boundary crossing. The nice thing, I think, about ethical dilemmas is they're at least a little bit obvious. And so examples of this would be saying, I'm practicing, I'm working with clients, and I don't have a license, or my license has lapsed. I haven't done all of the requirements for it. This could also mean that I'm practicing beyond the scope of my competence. So for me, for example, like I said, I've worked a lot with college student mental health, and I've had training with other populations. But if I were to go out tomorrow and open a practice with, say, 5-year-olds, really focusing on children, I would say I'd be practicing beyond the scope of my competence. So I love playing with kids, but I wouldn't say that I could provide psychological services to them. Perhaps the most obvious, or the one that comes up kind of the most, certainly it's portrayed in the media enough, is when a psychologist has sexual relations with a client. I'm always a little bit surprised because this feels like so obviously a boundary crossing, and yet what the research or stats would indicate is that this is the number one violation that leads to practitioners losing their license. So it does come up still. Now, if you're interested in these violations, you can actually Google different state licensures and see what are some of the typical violations that happen in a particular state. So when have there been complaints and what have they done about them, things like that. So ethical violations, while obviously bad, are a little bit more clear and easy to see. Ethical dilemmas, on the other hand, are a little bit more nuanced. So something is considered an ethical dilemma when whether I take an action or not, whatever I do is going to lead to me violating at least one ethical standard in some way. And so that's why it's a dilemma. So what do I do? What's the best course of action? And unfortunately, this is something that's encountered in everyday practice. I always talk with my students that when I was going through my training, I started learning about ethics more and just thought, I'll just avoid them. I'll avoid these dilemmas and then it'll be no problem. And the reality is you can't avoid them. So hence going back to the importance of having an ethics code to help guide the decision making. Just to give one example, it's a little bit extreme, but hopefully can clarify, what are we talking about with dilemmas? Is this idea of duty to warn. So duty to warn is actually a legal component, and it conflicts with a part of our ethics code. So as practitioners, we are supposed to maintain confidentiality of the content that our clients share with us. And duty to warn says that we must break that confidentiality under a particular circumstance. So if a client comes to me and says, I'm seriously considering harming this other person, legally, I am required to warn that person that they are in danger. And so there's this conflict then where I'm technically crossing the line with breaking confidentiality, but it is as a result of this need to follow sort of the legal laws and to make sure that everyone is safe. There's many more examples of ethical dilemmas, and as I said, they're quite common, so they come up a lot. So the question is, if these things happen, when do we really start to fall short and what really starts to contribute these? Now, on the one hand, one of the biggest things that really contributes to this is that practitioners just aren't thinking about what they should be doing, or they're acting impulsively. But I would argue that it's more than just sort of not thinking or acting impulsively. There's often other things going on with the practitioner that then contributes to them making these poor decisions. Again, I'm talking about psychologists in practice right now, but I want you to be thinking about, well, how does how I feel and how I'm doing affect what I do in my work? I think it's particularly important when thinking about human services kinds of jobs that it is important to consider, well, how is the person doing? If you're feeling a lot of stress, or you're feeling distressed, or you're feeling burnt out, you might start making decisions that aren't the best and may even eventually cross into those ethical violations. So one way that this is talked about in the field of psychology is by looking at this continuum here. So of stress to distress to impairment to improper behavior. And I do really like and think it's important that it's represented as a continuum. So all of us feel stress. And if we were in person right now, I might even ask you to say, who right now is feeling stressed? I certainly know that I'm feeling some of that stress, just given we're living in a pandemic. It's kind of middle to end of the semester for me. There's a lot of things going on. So stress is normal. We all feel it. And some stress is actually good for us. So if I'm not feeling any stress at all, I'm probably going to feel kind of bored. I might feel kind of lazy. I'm not going to feel like doing the things I need to do. So I need some amount of stress to help motivate me to get things done. It's when I start to experience too much stress that I start to fall into this category of distress. And that's where now I'm just not feeling good about this stress. I'm feeling overwhelmed. It's kind of this subjective appraisal of, oh, the stress is really bad. This isn't safe anymore. which can then lead into this impairment. And impairment can start out kind of small, right? So forgetting to call someone back who's a client, forgetting to respond to some emails, making some choices quickly without double checking things, which then we can see if it keeps going and we don't address the sources of this stress and distress can then really lead to this improper behavior. So making decisions that potentially can harm the clients or the people that we work with. And again, while this feels very important and relevant to me when I'm working with students or when another clinician is working with clients, I think that we all can think about examples in our work lives of when we've been just feeling kind of run down, that maybe we've made a decision that turns out wasn't perhaps the best. Hopefully wasn't unethical, but we could see where, ooh, it could get there if I'm not taking care of myself. Within this continuum too, I'd like to mention this concept of burnout. So burnout has certainly been studied within mental health professionals, but has been studied within other workplaces as well. And there's commonalities across sort of all of these work opportunities. So what really captures what burnout is? Well, burnout is a subjective feeling, but here's some potential characteristics. So that physical or emotional depletion. So your body literally may just feel more tired. You feel more exhausted, even though you're trying to get sleep, even though maybe you got enough sleep, you still feel tired. Or emotionally, you feel like there's just no more in my reservoir. I have no more to give to people right now. It can also lead to this development of cynical attitudes. So, for example, if I'm feeling burnout in my work with students, if a student emails me to say, this is why I missed class, or here's why this paper is due, I may not be able to take a very gracious approach to it. I might start to say, oh, these students don't care about what we're talking about, or this student is disrespectful, when the reality is what they're sharing with me may be very true. But I'm so burnt out, I don't have any deep wells of compassion left to give to that student. So cynical attitudes there. And then finally, burnout can also be reflected in sort of a loss of professional self-efficacy. So self-efficacy in general is just my belief that I can do something effectively and well. And if I've lost my sense of professional self-efficacy, I may feel like I'm not very good at teaching. What's the point of this? And can really lead to, again, this slippery slope then of me not being able to do my work effectively. We also know that burnout has been directly connected to things like missing work, intending to quit or actually quitting from a job, and decreased job performance. So hopefully you can start to see that when we get to these points of impairment and burnout that could lead to improper behavior, that this really starts to affect our ability to make good ethical decisions. In an ideal world, we're all staying at least in that stress or less part of the continuum, and we're able to be thoughtful about our decisions, and we're able to be careful about our decision making. But the reality is, when we're feeling burnt out, or we're feeling more these higher levels of impairment, we're more likely to make some decisions that aren't the best. And again, I'd encourage you to maybe think a bit to yourself, when you're feeling really, really stressed or overwhelmed, how does your behavior change? I think a really simple example, I think about it just in home life or with your family. If you're feeling really, really stressed, I know my patience levels go down. And so something that yesterday didn't bother me might really annoy me, and I might snap at my partner, even though I don't mean it and he doesn't mean anything by it either. So I think trying to think about, well, gosh, how does this affect how I'm feeling, and how does that affect my behavior? So I want to shift then. I think there's plenty of different ways that we could talk about how to help with this. But I want to kind of focus in on this idea of self-care. I do feel that this idea of self-care is monumentally more important now in the middle of a pandemic, and sort of everything that's going on in the world these days. So that's the area I'm choosing to focus on. There are, of course, plenty of other areas that one could focus on when thinking about ethical decision making, such as how do we have ethical decision making models? What steps can I take to make a good decision? So please know I'm just focusing on one area. So I do want you to think for yourself for a moment here. When I say self-care, what pops into your head? What comes to mind for you? And how do you feel about it? Are you like, yeah, self-care is great? Or are you like, ugh, self-care, like who has time for that? I think a lot of times when I talk to people, sort of the stereotypes of what come up are things like taking long, luxurious bubble baths, doing face masks. And I'm not talking about face masks to help prevent the spread of COVID. I'm talking about hydrating or exfoliating face masks, like at a spa day, or doing pedicures. And I think, absolutely these can be great ways to do self-care, but they certainly don't fit for everyone. Personally, I really don't like bubble baths. So that's not a good option of self-care for me. But I think sometimes when this is the only thing we think of with self-care, we maybe immediately get a little bit turned off by it. We don't really want to talk about it. It's not for us. That's for other people who have more time. And so what I want to talk about, we'll kind of come back to specifics of maybe what one could do for self-care, but I want to talk about kind of first, how could self-care be related to this idea of ethical decision making? How are these two things potentially connected? So in the last about 15 years or so, it's begun to be talked about a lot more in the field of psychology, that not only is self-care a good thing that we should do and we should tell our clients to do it, right? But that self-care is actually an ethical imperative for us as psychologists. And then I would argue we could expand that it's an ethical imperative for all of us. So certainly when I say ethical imperative, that's some pretty strong language, right? So you, in order to be ethical, must do this self-care thing. But what has been argued by some of these researchers and these other psychologists is that self-care is what's going to help to prevent us going too far in that stress distress continuum or to falling into this burnout. Now, in terms of defining self-care, I think very broadly, it's simply the intentional, deliberate action to care for our emotional and physical health. And as we'll talk about in a moment, truly that is individualized. It depends on the person, what makes the most sense. But I think what is important is it's both intentional and it's deliberate. So it's something that we're really attending to. Now, as I mentioned, I think the way that I really see this connecting to our ethical decision making is that self-care may actually help to prevent something like burnout. And if we can prevent burnout, perhaps then we can help to make sure that our decisions and our choices and the way that we interact with people is that much more thoughtful and that much more careful. Certainly as a psychologist, I love prevention. We know that if we've experienced too much distress or burnout, there's things we can do to intervene. But I get really excited about, well, what could we do to avoid even getting to that place? And so I think self-care is one of those things that can really help to prevent burnout. Additionally, the literature and research has also focused on what you as an individual can do for self-care, but also talking about the environment. So thinking about what is it in the culture of this organization that could help us to reduce this burnout by increasing this role of self-care. All right, so what can we do? Well, it's probably not that simple, but I do think there's some very basics, right? So I call these the low-hanging fruit. You need to, eat balanced, you need to get enough sleep, and you need to move. We know that these are challenges for all of us, especially the more stressed we get. What's the first thing that goes off my to-do list when I'm stressed? Getting my exercise in. When I'm feeling super stressed, what do I want to eat? well, I want to eat more ice cream, or I want to eat something that's just really maybe a little more greasy than what I would normally eat. The number of times I've had students come or clients come to my office, they're very upset, very emotionally vulnerable. And we're talking for a while and they say, yeah, well, I only got 3 hours of sleep last night. It's kind of amazing. Of course, you're feeling this way right now. Doing things like the basics of eating balance, getting enough sleep, and moving enough can help to reduce our vulnerability. Now, one night of good sleep is not going to all of a sudden make us not burn out, but it's the cumulative effect of doing this over and over and consistently as much as we can. A few other things that we can possibly do that I think may help with, again, supporting this ethical decision making by reducing our emotional vulnerability is to really reframe self care. So, self care is not necessarily taking a bubble bath every day. Rather, self care should be thought about like brushing your teeth. It should be done daily. So, what are little things that you can do to incorporate self care into your life? I really love this idea of thinking about it like brushing your teeth. So for the most part, right, we know the recommendation is that you need to brush your teeth twice a day. You should also probably be flossing. You could also brush, after every meal. I'm not a dentist. Perhaps one of you is. I could share the guidelines. But for the most part, I would say we don't question our dentists and say, oh, well, I, don't have time this week. So I brushed my teeth once this week. We say, okay, that's something that's just part of our routine that we need to do. So if we can reframe self-care to say, this is just part of my routine, I need to go for that 20-minute walk after lunch, or I need to make sure I call my friend to check in with them so I get that social connection. It really kind of pushes us to say, this is sort of a mandatory thing that I have to do in order to be healthy and to be well. Just like I'm going to make sure I brush my teeth regularly and I'm going to work on my flossing. The other thing we can do with self-care is to personalize it. So like I said, what works for you probably doesn't work for me and vice versa. But I think really being able to tune in, what is it that I need right now, can help to determine what to do next. So do I need rest, or do I need to express myself in some way? Do I need to have companionship and be with my friends? And whatever that answer is to these questions, it's then making choices that help to fit with those personalized needs. And finally, I think, again, moving beyond just the individual taking care of themselves, but really thinking about communities and cultures of self-care that promote taking care of yourself, that promote these sort of emotional vulnerability reducing behaviors. So is there a way to implement a culture of self-care, and what could that possibly look like? This is something that I've had some really fun conversations with colleagues about in the past, and have enjoyed kind of brainstorming what that could look like. And the answer is, this is hard. I don't think it's easy. We don't have great models for what it looks like to have a workplace or an organization that promotes self-care. But I do think it's one thing that can make a huge difference in how people feel about themselves and then how they can do their work effectively. So I want to sort of end there with some discussion questions for you all. I know you may have some time to talk with each other about some of these topics, and so I wanted to provide some things for you to consider. So those are provided here. I've also provided those to your coordinator as well. And I just want to say sort of in sum that, I've been talking a lot today about how ethics play out for psychologists, but I think and hope that you can see connections and relevance to your own workplace, that in terms of how we feel and what that looks like in terms of stress, distress, burnout, impairment, that when we start to get too far on that distress burnout area, we can see it impacting our work and potentially leading to us making decisions that are not so great and that are potentially even unethical. And so the one way I want to offer that we can address that is through our self-care. and reducing our vulnerabilities so that we're able to put that energy into making any important decisions that happen. Additionally, in terms of these questions, number 4, what would it look like for an organization to have a culture of self-care? I think this is a fun one just to think about. What would need to change? How could that possibly look? How do you promote it? And then also for you to think about and discuss with each other what parts of this presentation resonate with you and what parts do you disagree with. So this is obviously just one interpretation. And I think it's great to discuss what makes sense, what doesn't make sense, what works, what doesn't work. So thank you for spending this time with me this morning. I wish I could have been with you either in person or live in Zoom, and appreciate your flexibility in allowing me to do this as a video presentation. So wishing you all the best, that you stay safe and healthy as we continue throughout this year of 2020. And my hope for all of you is that whatever self-care looks like for you, you find moments of ease to practice that. So thanks for having me.